this way we are taking the history in our clinic also. In Sanskrit terms, only Vachan Vibhakti we are skipping because all the students may not be able to write it with Vachan and Vibhakti. But Sanskrit terms we are using because it is very important to note that in Ayurvedic terminology, because just when we say, for example, heaviness in the eyes, and when we say Netra Gaurav, that makes a lot of difference. When we say Netra Gaurav, immediately we are reminded that Majja Netranga Gaurav. So we understand that, oh, it is linked with Majja. That will not be reflected when we say that heaviness in eyes. So that's why we insist that Ayurvedic terminology should be used. Of course, we can translate it in any language whenever required. So he had Bharakshay, Tivra Durbal, and his hemoglobin went to even 5 gram. During chemotherapy, he had Atigrathit Malapravati, very hard stools, and sometimes Draumala. Now, this is indicating that Grahani Daurbalya was also there, and he was landing in Grahani almost. Then he had Daurbalya, Bharakshay, Manda Shirashul, Adman. So he was diagnosed as non-Hodgkin's lymphoma, diffuse large B-cell lymphoma. And the starting was in distal ileum, and that's, as I told, that was resected. But all over his body, at many places, lymph nodes were present, enlarged lymph nodes were present all over his body at many places. So that's why he was diagnosed as stage 4. So his weight reduced to 44 kgs. He also had a history of bleeding piles. Arsha and Grahani are also very much linked. Both are related to Agni Mandya. Khandit Nidra. Swed Apravartan, that is one part of Pandu. In Pandu, Swed Pravarti is less. In Parikshan, Ayurvedic Parikshan is also very important. In the Nadi, Saman, Vyan and Apan, they were mainly found. And volume full, that means that indicates that amount of doshas, Vikrut doshas, and Angushtamul Parvat Nadi indicates Shukra and Ojakshay if it is prominently observed. And that was observed over there. And then when we observe that Nadi, then we find that this elevation over here, it is lost in those patients, some of them. It becomes flat or it becomes Mardav over there, very soft. So all these changes take place due to Shukrakshay and Ojakshay. Of course, overall the person may have mouse Medokshay, and that's why also they may be observed. But in these patients, at other places, that much mouse Medokshay is not observed, but here it is observed. Then we differentiate that it is due to Shukra and Ojakshay. Udar Admadvani, Yakrut Vruddhi was there, 2 fingers palpation was there of Yakrut. Atikarsha, Gandakshikut Shot is also linked with Pandu, Netra, Pitabha and Arakta. So based on his examination and all, so what was understood that initially he had symptoms related to Agni Mandya, then he had symptoms related to Grahani Daurbalya, etc. And then he developed Pandu. Now he is having so much Dhatukshay that almost he was approaching to Rajyakshma. And that's why for him what was selected, Chaturmukh Ras, when digestion is not proper, when Grahani is not functioning well, and due to that, when Rajyakshma takes place, then for that purpose specifically Chaturmukh Ras is selected, and that's why that was selected for him. And Hirak Rasayan was selected for him, that was given in the morning. And to improve Gati of Saman Vayu and improve the functions of Grahani, Panchamrut Parpati was given along with these medicines. So there are specific reasons why these medicines are selected, but about each medicine I am not going to give explanation because it will take a long time. Only about important medicines I will say a few things. So this is given in Saman Kal. Okay, we have got very good concept of Aushad Sevan Kal, and when we make use of that, our results are better always. So that's why we have got this advantage. And why not to use that? I don't understand when Vaidyas write twice in a day, thrice in a day. When twice? Before meals, after meals, between meals, morning, evening. When twice? दिन में 2 बार, दिन में 3 बार. नहीं समझ में आता क्योंकि ग्रंथों में they have given औषध सेवन काल and we should make use of that. So in Saman Kal it was given because that was needed to act on Saman and on Grahani. That's why at that time. And also to improve Parinaman from Rasa to Rakta and further Dhatus, Tapyadi Loha was used. And of course these medicines when they were used, because Vyan it carries the nutrients to the dhatus. Vyan performs vyuhan of the dhatus, and vyuhan is described by Chakrapani as vahan and samrachna. That means transportation of the nutrients and arranging them into that dhatu specifically. So that's why these medicines are given in Vyan Udankal, because Vyankal is only one and we want to give the medicines in divided doses. That's why Vyan Udankal we are using. So after meals, Navya Soothshakar is a specific medicine. The part of Soothshakar is not changed, but some additions are done to that by Vaidyaraj Gayakwad from Solapur, and therefore that becomes more effective, and therefore becomes more like in his words broad spectrum. So in many other conditions it can be used. So that's why we are using that in these patients. So that will regulate the gati of Vyan, and that's why Vyuhan of the dhatus will be proper. That's why in Vyanudan Kal it is given, and of course it will also perform Ampachan, but it is also giving bala to the dhatus also. That's why all these medicines are selected. Kukkut Nakhi removes the Vikrut Vruddhi, but at the same time Kukkut Nakhi regulates gati of Vat. Of course Kukkut Nakhi is Medhya also, so that's why it was used. And since he had certain symptoms related to Krumi, initially Krumi Kuthar was given to him. In the night, Krumi medicines for Krumi are usually given, because in the night Krumi become Balwan. So that's why. And then the medicines for Krumi should not be given continuously, because then they don't have that much effect if continuously they are giving. That means Krumis become used to that. Krumi are not like doshas. Krumi are living beings. So that's why they can try to save their lives. They can try to survive. So that's why that also we have to consider. So that's why after 5 days, after a gap of 2 days, it was given for few days. So in the first follow-up, when he came back, almost all his symptoms were decreased. Rullas, Udarshul, etc. was decreased. Appetite, Kshuddha was increased. Malapravritti was proper. He was not able to hold, that means the urge of urine previously, but now he was able to hold. That means at least till going to the washroom he should be able to hold. No? So this was his parikshan. So Purnatva became less, so that means dosha, praman of doshas was reduced. Gandakshi Kutshot was reduced, Yakrut Vruddhi was reduced. In where exactly we get Admadhvani in the abdomen, that is also significant. So when Vam Kukshan Vangshan, Vam Vangshan, when we get Admadhvani, that indicates that mala is not properly evacuated. That is indicated by that. So it will take a long time to explain that where we get Admadhvani and that therefore what is the inference. But this is also very important. Pindika Mardha, why Pindika? Because that is Pindika is Mausa Ghatit. So to perform parikshan of mouse and Sauhanan, we examine Pindika, that becomes easy for us. So there Mardava and Shaithilya was reduced. So that means Sauhanan of mouse was improving. Karshne was reducing, Prabha Hani was reduced, yet Prabha was not increased, Prabha Hani was reduced. Then later on what happened? So I am not giving all the follow-ups. Almost 2 years he took treatment. He was coming from a long distance from near Kolhapur to Goa. He was coming and he took treatment for almost 2 years. His weight was increased by 9 kg. His strength was increased. Karshne was not there now. Prabha increased now. All enlarged lymph nodes were completely resolved. In the next reports, it was found all over the body. They were there, but they were completely resolved. There was no abnormal lymph nodes. Enlarged lymph nodes were found later on, and he was having AIDS also. So there were chances that previously he used to get repeated various infections he used to get. But during this period, he didn't get any infection when he was under Ayurvedic treatment. Rather, even his CD counts also improved. He discontinued Ayurvedic treatment in February 2016. That means he should have gradually we would have reduced the medicines, and then we would have asked him to stop the medicines. But before that only, he thought that now I am all right, so he stopped the medicines. And then onwards, he did not communicate to us, but the Vaidya who referred him to us, he later on told that even after discontinuing the medicines also, he was all right. He was having good quality of life for many days. Then later on, he again started indulging in various hetu, and then later on his condition again worsened, and finally he died in 2018. But without any modern treatment, as long as he was on Ayurvedic treatment, and then onwards also, he was completely symptom free, having good quality of life, and in reports also, all his lymph nodes were completely resolved. These are all his reports, initial reports. So I have told you the important points from that, because it is not easy to read from a distance, all these reports. But so in this, you can find that at various places, lymph nodes were present all over his body. Hepatomegaly was also present. This was in the next report when he started the treatment. And finally, in this report, uh, lymph nodes were not found. Now, it is a practical difficulty that all patients will not be immediately ready to undergo CT scan, because economic part is also there, and they don't. We have to insist them that go. Then sometimes they will go. And another practical difficulty is that PET scan is not available in Goa easily. That's why if we want to do PET scan, we have to send the patients to Belgaum, Mumbai, somewhere, and that again becomes even more difficult. So that's why if you will say that why PET scan reports are not there, this is the reason for that. But even this report you can find, and even his blood reports, in that also we confirmed it, that further growths were not there. Now, one more case, one lady of 45 years, unmarried. Actually, the reason for that is that she was diagnosed as having schizophrenia, and that's why she was unmarried and she was at home. And her history from Ayurvedic point of view is that mainly she was having Vaivarnya, discoloration in various parts of the body, and itching kandu, and oozing of secretions from when after itching, on the scalp also, on hands and feet, on backside also, at various parts of the body. That were her presenting complaints. So why I'm telling this, that even this is related to rasadushti. Okay, so that's why I told you about the theoretical part, what I have told. This is linked to all of this. She was having history of schizophrenia since 20 years. And in 2014, she was diagnosed as high-grade DLBCL stage 4. Also, psoriasis was diagnosed in November 2013. This is as per the modern investigations. Now see at which places she had lymph nodes. At so many places, parapharyngeal, then multiple bilateral axillary and retropectoral lymph nodes, paratracheal prevascular lymph nodes, parapharyngeal, okay, that I have mentioned, bilateral hilar and inferior pulmonary ligament there, paraesophageal cardiophrenic, at various places, gastrohepatic, peripancreatic, at so many places enlarged lymph nodes were there. Mesenteric, common iliac, left femoral, gastrosplenic, peripancreatic, left gluteal, subpleural, spleen, left breast. The list is going on and on. At many places she had so many enlarged lymph nodes. Yes. So these were her reports when she came to us. So she was diagnosed as having DLBCL stage 4, and she was advised chemotherapy. Initially 6 cycles were advised for her, and 3 cycles were given to her, but then later on she refused to take them. She means maybe she and her relatives, because how much she understood about that is doubtful. After that, they approached us in 2000. At the end of 2014, beginning of 2015. So this was a parikshan, Vyan and Apan. Vacha Nadi, Koletkar sir was observing, that was there. And Tala Hruday is linked to mind, that Nadi. And Angushtamul Parvat, like I told, Shukra and Oj related Nadi was found in her, because already he was not mentally well. So that's why these Nadi were obviously found in her. Panduta, atikarsha. See, all these things are related to rasa pradosh. Now, it is a concept that all the dhatus contribute to oj, and in ojaksha it is told that bibheti durbalo vikshnam dhyayati vyatitendriya dushtayo durmana rukshaha. So which dhatu's contribution is less? Accordingly, different types of rauksha are observed in patient. So that we can diagnose, and from that we can understand which dhatu's contribution in oj is less. So here the rauksha was mouse made asthi up to majja, that rauksha was observed. So this was the treatment given for her to improve pachan, and to improve rasa dhatvagni functions, and the formation of the further dhatus. Suvarna Malini Vasanta was given to her, and Hirak was given to her. And as per her condition, that skin problem was also there, Mahatikta Grita was given to her. Again, Panchamrit Parpati was given to improve the functions of Agni quickly. Grahani, functions of Grahani and Grahanyashrit Agni. To quickly improve that, Panchamrit Parpati was given to her. And Tapyadi Loha, Gandhak Rasayan. Gandhak Rasayan also acts on various Dhatvagni like Rakta Dhatvagni. Rasamadikya, since she was having that skin problem. Guduchi, Haridra, Vanga. Vanga to improve Sarvadehik Shukra and Oj. Krumikuthar was given initially, and Abhyanga Udvartan was given. In the next parikshan, the symptoms were reduced. After we started the treatment, symptomatically she got relief. And not only in the symptoms, that means in the psoriasis, what was diagnosed in the skin, improvement was there. Even in her behavior, a lot of improvement took place, since we were giving medicines which will increase oj, and therefore manobala will also be improved. So in her behavior also a lot of good changes occurred, and they were not very reluctant, because economically there was a problem. So they were very much reluctant to take the reports. So finally we told that now we will not give medicine if you don't take the reports. Then they went to Goa Medical College and took these reports later on. And in that, I will not go in details. What was observed? This patient is surviving without any modern treatment since last 7.5 years now. Another important aspect is that she was not taking any modern medicine. That is all right. But Ayurvedic medicines, how she was taking, they will take 15 days of the medicine and they will come after 1.5 months or 2 months. But still, by the grace of God and by the that means effect of Ayurveda, we may say, still she is surviving well. Okay. Her hemogram, LFT, RFT, all normal reports are there. Now, you have seen wherever, all over her body, lymph nodes were present. Now, in the latest reports, because she has not taken the medicines regularly, all have not gone. But where the lymph nodes are there, only cervical lymph nodes and at splenic vessel, only there the lymph nodes are present. That to the size is different, and all other lymph nodes are resolved. And she is having even improvement in Unmad, and she is living symptom-free quality life up till now. Even in the last week, for the further medicine we have given, she is having good health. So, as you can see that we should have, parallelly we will have the knowledge of modern medicine, but our diagnosis should not be exactly based on that. We should think from Ayurvedic perspective. The patients are coming to us because the modern medicine, majority of the patients who are coming to us, they are treated by the modern medicine. If you will think in modern ways and only herbal medicines we will give, that will not be Ayurveda. We should think in Ayurvedic way. Our approach should be different. Then we will be able to find out a way which was not found out because of the conventional medicines. So that's why from Ayurvedic point of view, when we approach the patients and treat them, then this way we can treat the patients and good results we can obtain. That I wanted to convey to you, and how the Ayurvedic concepts are important in practice. That also I wanted to convey to the students and new entrants in the field of Ayurveda. So I thank all of you, and I thank you, the organizers, for giving me opportunity to share my views on this topic. Thank you very much.